Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. This evening's topic, I'm going to talk about the symptoms and treatments for a schizoaffective disorder. Now, when one talks about a schizoaffective disorder, if you understand any type of disorders, there are numerous disorders that fall under other disorders, just like the discipline of engineering. So when we look at a schizoaffective disorder, the branch that this disorder falls under is schizophrenia. So when we talk about a schizoaffective disorder, it's basically characterized by persistent symptoms of psychosis resembling schizophrenia with additional periodic symptoms of mood or active or affective disorders. Now, two types of symptoms are involved with a schizoaffective disorder. They are depression and mania. So under depression, there's always a chance that one feels constantly sad and fatigued. A person may have lost interest in everyday activities. You have people who are indecisive and unable to concentrate. They sleep and eat too little or too much, which could lead to overeating, which is an eating disorder, or undereating, which bulimia or anorexia could occur. Then they complain of various physical symptoms, and they may have recurring thoughts of suicide and death. Now, when it comes to mania, people suffer from sleepiness. They're compulsively talkative. They're also agitated and distractible, convinced of their own inflated importance. That's right. People with schizoaffective disorders are convinced of their own important ego. Basically, they become self-centered. So, to sum that up, they're basically convinced of their own inflated importance, which, if you've looked at videos in the past, that's narcissism. They're also susceptible to buying sprees, love to spend a lot of money, prone to cheerfulness turning to irritability. They also have indiscreet sexual advances and foolish investments. And also included under mania, paranoia, and rage. Now, there's also psychosis symptoms. That's when individuals talk about hearing and seeing things that aren't there. That's also known as hallucination. Bizarre thinking. They also have difficulty with emotions, or they appear apathetic. Changes in speech, have confused thinking. They're also paranoid. They're strange or out of order behavior. That's right, their behavior is very strange and it's out of order. Uncharacteristic type of behavior. And also, the emotional reactions are inappropriate. Now, when it comes to schizoaffective disorders, it's often confused with bipolar disorder with psychotic features. Now, both diagnoses include mood changes that impact life as well as symptoms of psychosis. Now, a person diagnosed with schizoaffective disorder primarily experiences symptoms of psychosis even if mood problems don't exist. However, when mood problems flare up, such as during a depressed or manic episode, the symptoms of psychosis can worsen. Someone who is diagnosed with bipolar disorder with psychotic features often only experiences psychosis during a mood swing. Now, the distinction is not always as obvious as the description suggests. Emotion and behavior are more fluid and less easy to classify than physical symptoms. Now, if you are not sure about your diagnosis, it's a great question to bring up with your therapist, doctor, or support person. A mental health professional can provide education and clarify issues to make you, as the individual, understand your options, including treatment. Now, when it comes to treatment, if a person is experiencing psychosis, a neuroleptic drug is most often used, since antidepressants and lithium is basically used for bipolar disorders. Uh, these drugs basically take several weeks to start working. Now, there are also antipsychotic medications. They should also help relieve symptoms quickly, sometimes as early as 3 to 5 days. Now, long-term use of older antipsychotic drugs have been known to cause tardive dyskinesia. That's a serious and sometimes irreversible disorder of body movement. After symptoms of psychosis improve, mood systems may be affected with antidepressants. Lithium and anticonvulsants or electroconvulsive therapy, that's known as ECT, sometimes a neuroleptic, is combined with lithium or an antidepressant and then gradually withdrawn to be restored only if necessary. Now, few studies on drug treatment of this disorder suggest that antipsychotic drugs are most effective. The greater effectiveness of these new drugs may be partly due to their activity at receptors for the neurotransmitter serotonin, which is not influenced as strongly by standard antipsychotic drugs. Now, outside of medications, finding help through counseling, family therapy, case management, peer supports, or other enhanced services like supported employment, supported education, or supported housing is very, very helpful. Mood problems and psychosis are likely to increase with stress and lack of sleep. Supports can help reduce stress, problem solve, provide additional resources and education, and help the person how to best recover from mental health problems. Now, for a schizoaffective disorder, combining therapy and medication treatments will increase chances of recovery. Having access to various types of treatment might depend on where you live. So, again, if you want to get help, there are plenty of professionals out there. This is a disorder. It has a combination of other disorders. Of course, I've mentioned paranoia, eating disorders. I'm going to get into that at a later time. But if you have been following all of my mental issues that I've been doing on my channel, along with health and psychological issues, they're all related. So basically, what I'm doing, I'm giving you an overview, which is the information to get you the answers that you need from the right people. Because in order to resolve any type of illness, one needs education, and the education starts with resources. Once you get the resources, then you can have an understanding on how to manage the illness, because you have individuals who are living normal lives, but they do have mental and psychological disorders. Now, you wouldn't know it because of their behavior state at the time that you may have approached that person. However, you have a number of people that are definitely dealing with psychological and mental issues as well. And the ones who are dealing with it are managing their issues properly. Now, you have some who aren't really managing the issues because they refuse help. But what I want to tell everybody out there, if you have any schizophrenia, eating disorders, hallucinations, get help. There are many resources out here. My videos are also resources. And some people need to look at themselves, because every one of us has some type of issue, whether we want to admit it or not. I know in the past I've had anger issues, but I was able to reach out, utilize my resources. Am I completely cured? No, I can get angry sometimes because I'm human, but I don't channel that anger to where I'm going to meet the unintended consequences at a later date. I channel my anger into doing educational videos like this so I can help people get through their mental issues, because with society as a whole, a number of us are sick in some way or another. From overeating to bulimia to schizophrenia, you name it. And more issues are coming to the forefront as more and more research is being done with psychology. And I urge people, if you want to study some of these issues that deal with the mind, become a psychology major, a mental health professional. It's a rewarding career, because not only do you find out about other people, but you find out about yourself. Because, again, the only way you can solve any mental health issue is to have the resources. And the first resource is my video, because this video will get you to the right people. Because at the end of the day, you only live once. So make the best of your life while you're here. And that's my commentary for this edition of the 411 Talk Zone radio show for this evening, Tuesday, May 23rd, 2017. You can tune in to the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest call-in number is 215-383-5785. If you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube, so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in debates, controversy, nor do I do emotional issues. Also, I don't participate in drama or unnecessary bickering. Why? Because it's counterproductive. This channel is to educate, because in order to grow, you must clear your mind of all of the corruption and bad influence that's around you. That's why you come to this channel, because I'm giving you the information that's realistic but positive. Remember, knowledge is power. And if you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, please leave your comment in the comment section under the video. But make sure that your comments are pithy, no bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed night. Good night.